Agenda 6, which was addressed by the Director General, and Agenda Item 8 addressed by the Regional Director. We'll take a short pause to arrange the room while waiting for it. Thank you. Now we will resume our joint consideration of agenda item 6. As usual, if you wish to speak on this item, please click the big button on your microphone. The next speaker is New Zealand, followed by the United States of America.
Thank you, Mr. Chairman. Director General, Acting Regional Director, fellow ministers, colleagues, and friends. Tēnā koutou katoa. It is a pleasure to be here at the 74th session of the WHO Regional Committee for the Western Pacific and reconnect with you all once again. Aotearoa New Zealand thanks the Western Pacific Regional Office for your efforts to advance the health priorities of our region this past year. We are heartened by the ongoing commitment to For the Future and our collective vision for a safe and healthy region. This week, we will select a regional director that will lead this vision and build a cohesive team to support its implementation. We will also discuss important topics such as health workforce and health security, issues which illustrate that while we are a diverse region, there are common challenges that require collective efforts to address. Turning to our national context, Aotearoa New Zealand would like to share developments in our own journey toward better health delivery and greater health equity. We are now 1 year into major health and disability reforms. These aim to address inefficiencies and inequities in our health system and ensure paiora, healthy futures for all. We continue to use evidence to inform new health strategies and programs, and we are applying the whole of government, whole of society approach recommended by WHO. In our experience, this is critical to ensure that we, as leaders, champion health beyond our own sector and focus on the wider determinants of health which impact our populations. Looking ahead, we are conscious that public health threats will grow in complexity and impact our region in new and challenging ways. We need to work together towards ensuring our health systems are resilient, including making smarter and more sustainable investments in healthcare. Too often, our health systems fail to invest early enough in the life cycle of disease and other health problems, meaning we fail to keep people well and they succumb to preventable illnesses. This creates huge health system inefficiencies and human costs. We must take up the challenge to ensure more targeted support for vulnerable communities, including our Indigenous populations. Last year, we reported on our Mai Te Rā initiative, which aims to address systemic racism and discrimination in our health system. This year, we are implementing Communication for Health and working with our health entities to test and trial a health system maturity model. We look forward to listening and learning from our fellow member states on your own experiences in this regard. Ma pango, ma whero, ka oti te mahi. As the traditional proverb of Aotearoa New Zealand says, through cooperation and collaboration, our hard work will be completed. Ngā mihi nui, thank you.
Thank you. I call upon the United States, followed by Brunei Darussalam.
Thank you, and good afternoon, Mr. Chairperson, DG Tedros, Director Jacob, delegates, and colleagues. Thank you for the report on WIPRO's work to support countries and areas of the region. The United States thanks all WIPRO staff for their dedication, particularly over this year and a half. We applaud WIPRO's work to build the health security framework and its connection to previous work on the Asia-Pacific strategy for emerging diseases and public health emergencies. We appreciate that it includes regional experiences, integrates critical lessons learned from COVID-19, and prioritizes usability, especially for small island developing states, and equity throughout the framework. We are pleased to see that primary care is an important theme throughout the report. Commitments to investing in essential primary health services, including reproductive, maternal, newborn, and child health services, will help us reach ambitious global health targets. We appreciate the opportunities for dialogue within the regional office to strengthen workplace culture and safeguard against and address discrimination. Updates on achievements, including the establishment of a management officer dedicated to preventing and responding to sexual misconduct, are welcome. We call on the newly elected regional director to continue to strengthen dialogues with staff to improve the workplace culture. We look forward to the conversations to come and the fruitful discussions this week on increasing impact at country level. Thank you very much.
Thank you. My call on Brunei Darussalam, followed by Federated States of Micronesia.
Thank you, Mr. Chair. Good afternoon, Mr. Chair, Excellencies, ladies and gentlemen. Brunei Darussalam welcomes the report of the Regional Director and congratulates the Acting RD and her team for the achievement made over the last year. We are pleased to see that the Regional Office continues to put emphasis on NCD control. As the leading cause of mortality, NCDs remain the biggest challenge for us in Brunei. To address this, we have established the Brunei Center for Disease Control and Prevention to consolidate and strengthen our public health workforce and bring greater focus and attention to key public health challenges. Building on the lessons from COVID-19, we continue to prioritize health security preparedness activities at the national and global levels. As a small country with limited state capacity and prior experience for responding to prolonged and large-scale events, we are aware of the importance of strengthening our multilateral health security architecture as our first line of defense against pandemics and public health emergencies of international concern. To this end, we value the work of WHO in supporting the member state-led process to revise the IHR and to negotiate a new global pandemic convention. We reiterate that equity should be at the heart of these initiatives, and Brunei Darussalam will continue to actively contribute to these processes. We look to continue our existing collaboration with the Western Pacific Regional Office. Our joint collaboration cannot end with just an action plan or a comprehensive document. We should emphasize on the achievements of outcomes. Strategy execution is as important as strategy development, and we look to the WHO to work with us to ensure a relentless focus not just on the what, but also on the how, particularly at a time when the fiscal envelope for health programs is more limited. For its part, the support that WHO provides to member states has to go beyond extensive reporting templates, surveys, data collection tools, or more requests for documentation. This may have unintended consequences of overburdening already stretched health systems. Further recommendations from WHO should be tailored, context-specific, and link practical and realistic solutions to the problems countries face on the ground, taking into account the overall health priorities of the country and resource capacity gaps within each country. Much has been achieved, but more can be done. Thank you, Mr. Chair.
Thank you. My call on Federated States of Micronesia, followed by Cambodia.
Thank you, Mr. Chairperson. Honorable Ministers, Dr. Tetros, Acting Regional Director, Dr. Suzanne Jacob, Honorable Ministers, ladies and gentlemen. Can I begin by first congratulating you, Chair, and the other office bearers for assuming leadership of the 74th RCM. My delegation supports you and will work with you during this RCM. I also acknowledge the support of Dr. Tetros, members of his cabinet team from HQ, extended to Dr. Jacob during our time as Acting Regional Director in the Western Pacific. Such support made a big difference. FSM welcomes the report of the Regional Director, which not only details what the WHO WIPRO took on during that period, but also highlighted success stories and lessons learned in its engagement with member states and areas. I am particularly pleased to learn that the WHO has been able to implement important public health initiatives that were delayed or impacted due to COVID with full horsepower, with special focus on integrating the lessons learned from COVID-19 into the overall health system's strengthening. As a small and fragile health infrastructure system, we are all still recuperating from the aftermath shock of COVID-19 while struggling to maintain the little gain. Rebuilding, re-strengthening, refocusing on how we do business in the health sector is necessary. In January 2024, we will hold our second FSML Summit, where we will plan our health priorities for the next 10 years, involving stakeholders and policymakers. Much of the lessons learned from COVID-19 with a focus on UHC will be integrated into the framework expected to be emanated from this summit. To conclude, the FSM would like to thank Dr. Jacob for her dedication, sacrifice, and willingness to take on the role of acting RD and keeping the fort together for our WHO WIPRO. Thank you.
Thank you. My call on Cambodia, followed by Kiribati.
Sorry. Honorable Chair, Excellency, ladies and gentlemen, I would like to commend the significant achievement over the past year under the acting regional director leadership with a dedicated WHO team working together at country and regional level. Cambodia has been achieved significant health outcome in the past decade that has changed many people's lives for better. In collaboration with WHO, Cambodia applying lessons learned identified from the COVID-19 response to broaden health security preparedness response, including response to human case of avian influenza using a multi-sectoral One Health approach. Cambodia also reached a significant step toward eliminating all malaria species by 2025. PAC has contributed to many significant health achievements toward UAC with promoting the country PAC booster implementation framework. And this month, the introduction of HPV vaccine for 9-year-old girls into routine immunization program. It will now be available free of charge across the country. We prioritize building health system capacity for early detection and management of NCD at most of health facilities in collaboration with the WHO and health partners through multi-sectoral approach. As the country emerged from more than 3 years of COVID-19 pandemic response, and we move forward under wise leadership of Samdech Akek Mahasenapati Techo Hun Sen, former Prime Minister, and the current expert leadership and guidance of Samdech Mahabowatthapati Hun Manet, Prime Minister of the Kingdom of Cambodia. It is important that WHO and Royal Government of Cambodia are in line on key health priority of Cambodians so we can become healthier nation in the year ahead. Cambodia is rapidly developing and people demand for health services will continue to grow, which is why the Royal Government of Cambodia WHO are currently working together to finalize new Cambodia WHO country cooperation strategy 2024-2028. I wish all a successful regional committee meeting. I thank you very much.
Thank you. My call on Kiribati, followed by Malaysia.
Thank you, Honorable Chair. To the Director General WHO, Acting Regional Director WIPRO, Honorable fellow ministers and your delegations, WHO staff and esteemed partners, distinguished colleagues, ladies and gentlemen, Kamnamauri and warm Kiribati greetings to you all. As we gather for this year's 74th session of the Regional Committee for the Western Pacific region, it has been a great opportunity to start off by witnessing the delivery of the Acting Regional Director's address to member countries and the delivery of the annual report. Ladies and gentlemen, annual reports, though often overlooked or undervalued, provides a good starting point for important meetings such as this regional committee meeting, as it allows us to reflect, it allows us to learn as a region on the organization's achievements and important milestones. I would also like to take this opportunity to express my country's heartfelt thanks to you, Dr. Susanna Jacobs, for your leadership role, and for sharing the comprehensive report on the work of the World Health Organization in the Western Pacific, which provides to us an in-depth analysis of the region's health landscape, highlighting challenges and future opportunities that lie before us. Please allow me to touch briefly on a subject matter that is important to my country, and this is the issue around health equity. As health leaders and officials, we have the responsibility and the accountability for ensuring health equity for our people. However, as we set the stages for the discussions over the next few days, it is important that we also consider the concept of equity from the perspective of member countries' access to WHO's resources and support. By resource equity, I am referring to a country's share of WHO's resources and support being proportional with countries' health statistics and levels of need. Esteemed colleagues, I am raising this as over the years, the many years, my country continues to have one of the worst health statistics and health outcomes in the Pacific region. And my country looks up to WHO and other partners for greater levels of support. This, ladies and gentlemen, echoes a similar statement that I made at the recent Pacific Health Ministers meeting in Tonga last month about the need for further tailoring WHO's level of support to member countries' health realities. In conclusion, ladies and gentlemen, I believe I speak for all of us here when I say that we are honored to have witnessed this comprehensive report delivered by the Acting Regional Director for the Western Pacific region. We are deeply appreciative of your leadership, of your knowledge, and more importantly, of your unwavering commitment to the well-being of our people within our region. And we thank you for being part of our Pacific Health Ministers meeting last month. Thank you to you, Acting Regional Director, Dr. Suzanne Jacobs, and thank you to all of you for your attention. Kamdapa.
Thank you. My call on Malaysia, followed by Vietnam.
Thank you, Honorable Mr. Chair, Director General, Acting Regional Director, and Excellencies. Congratulations to Acting Regional Director, Dr. Suzanne Jacob, for guiding the region's transformative initiatives, and the report on WHO regional work is a testimony of her able leadership working with member states and partners in reaching the many milestones for this region. Noting the progress made by the region, Malaysia acknowledges the tremendous work done by our WHO colleagues in supporting countries to address the wide range of thematic health priority areas. At last RCM, we pledge a commitment to primary healthcare reform, one that focuses on population health and well-being. As a case in point, the government of Malaysia introduced the Madani Medical Scheme, or Scheme Perubatan Madani initiative, to sustain the health needs of the underserved population, especially for rendering free treatments and referrals for acute cases at primary care centers, which is partnership between the public and private sectors. Advancing the agenda on mental health as a universal human right, Malaysia has recently passed a bill on decriminalizing attempted suicide through the Mental Health Amendment Bill 2023. This is a significant shift in the country's legal reforms to recognize suicide as a mental illness and focuses on access to quality mental health services instead of punishment. The National Centre for Excellence for Mental Health, NCEMH, in Malaysia has been set up to minimize the gaps and focus on digitalizations in the provisions of mental health services in developing and executing promotions and preventions effort in mental health within the community. Malaysia is pleased to have hosted the preparatory meeting for the 10th sessions of the Conference of Parties to the WHO, FCTC, and third sessions of the MOP to the Protocol to eliminate illicit trade in tobacco products recently on 18 to 21st September 2023. We are proud to be the very first member state within WIPRO to have hosted this meeting, and once again, we wish to sincerely thank WHO for the strategic partnership that we share, in addition to the excellent participation by representatives from WIPRO member states. As part of the healthcare system reforms, Malaysia has recently launched the Madani Afia program to disseminate basic disease prevention information and health promotion programs to the people, comprising of door-to-door health screenings and health fairs in local communities. Malaysia wishes all the very best to the 5 candidates for the RD position, as we do believe that they all have unique strengths, and we pledge our utmost support to the elected RD. We believe that this meeting will undertake its responsibility in selecting leader who will work in close collaborations with member states in coordinating WHO works for a healthier and safer region. Thank you very much.
Thank you. My call on Vietnam, followed by United Kingdom.
Dear Mr. Chair, leader of WHO, distinguished delegate. At this regional meeting this year, I'd like to commend the regional director, the director general, and the whole WHO for yet another remarkable year in making the region and the world healthier and safer. This year is the 75th anniversary of WHO, a milestone of history of global public health. Over more than 7 decades, achievements in public health have dramatically improved the lives of people around the world. These include the quality of life for the Vietnamese people. Vietnam has enormous health gains, include life expectancy expert increasing significantly to over 75 years and major poverty reduction. Today, Vietnam continues to undergo health sector reform to address future health needs, especially given rapid socio-economic development and lessons from the COVID-19 pandemic. These lessons include the value of our strong, resilient health system and whole of society approach, strong and effective leadership at every level, great community efforts, the timely contribution from healthcare workers, and ensure vaccine reach every corner of the country. Since last year, Vietnam has been transitioned to sustained management of COVID-19, balancing social and economic development with public health measures to protect the vulnerable and the health system. This long-term thinking and approach align with the WHO's transition from emergency response to the long-term management of COVID-19 alongside other infectious diseases. We need to sustain capacity gain of pandemic and at the same time prepare for the future health emergency to avoid the cycle of panic and neglect. In rising to this and many other challenges, we are heartened to know that we are not alone. Vietnam will continue to build a healthier and safer future, relying upon the resilience of its people and long-standing solidarity with WHO. I'd like to say that WHO is with our people in sickness and in health, and we are sincerely grateful for WHO dedicated support to Vietnam and other countries in this region. In more ways than one, we can all come together to make the Western Pacific is a healthy and safe region. Thank you very much for your kind attention. Thank you.
Thank you. Before I call on the United Kingdom, may I ask delegates to please wait for the mic to go red when their country is called. There is no need to press the button again when it is your turn to speak. Thank you. Now, may I call on United Kingdom, followed by Singapore.
Thank you, Mr. Chair. The United Kingdom would like to thank the Director General and the Acting Regional Director for their remarks. It's an honour to be in Manila to participate in the 74th session of the Regional Committee. We'd especially like to thank the Acting Regional Director for her leadership during a challenging period for both staff and the region. We have appreciated your efforts to accelerate work towards positive organisational and cultural change, including systems for reporting and responding to abuse and harassment. We hope that the incoming Regional Director continues to drive forward WHO's reform agenda, including through building a respectful workplace. Honourable Director General, the United Kingdom would like to associate itself with your call for more flexible and sustainable funding for WHO, including through increases in the proportion of WHO's funding from assessed contributions. The UK is proud to make the largest flexible core voluntary contribution to WHO, enabling the organisation to respond effectively to member state needs around the world. Acting Regional Director, Your report highlights real achievements on preparedness for health emergencies, primary healthcare, and progress on universal health coverage, despite the immense challenges presented by the COVID-19 pandemic. However, despite this progress, challenges remain to the achievement of the Sustainable Development Goals. In the face of increasing impacts of climate change, to which this region is particularly vulnerable, we must maintain momentum on strengthening health systems, including the health workforce and capacities to prevent, detect, and respond to health emergencies. This year, the United Kingdom, together with Fiji, was pleased to co-host an event on climate change and health at the World Health Assembly, and we welcome the inclusion of this priority in WHO's draft 14th Global Programme of Work. The United Kingdom would like to reaffirm our commitment to the region and to health for all. Thank you.
Thank you. May I call on Singapore, followed by Republic of Korea.
Thank you, Mr. Chair, and a very good afternoon to ministers and colleagues. Singapore would like to thank all BPRO staff, including Dr. Yaacob, for the tremendous work done over the past year. It's no easy feat given that our region covers 1.9 billion people with diverse health needs and challenges. I wish to share 3 reflections. First, as the world and our region gradually move on from COVID-19, we must guard against falling back into the panic and regret cycle. It's crucial for member states to continue to strengthen pandemic preparedness and regional health security. Singapore strongly supports the endorsement of a new Asia-Pacific Health Security Action Framework to advance multi-sectoral health security capacities in the region. We are also fully committed to advance the negotiations of the Pandemic Accord and the Working Group on amendments to the International Health Regulations. Second, Singapore welcomes WIPRO's efforts to transform health systems from a sick system focused on disease treatment into a health system that promotes health and well-being. As our region ages and the health burden grows, we need to invest more in health promotion and preventive care. In Singapore, we have adopted such a philosophy. Our national Healthier Singapore strategy was initiated last year, and among the key prongs are mobilizing family doctors to deliver preventive care and harnessing community resources to forge healthy living environments. Third, we must not lose sight of other health priorities of our region. This will include antimicrobial resistance and digital health. Singapore will continue to support our region's work in the priority areas. Singapore looks forward to a continued partnership and cooperation with WIPRO and fellow member states to advance our region's vision to be the healthiest and the safest region for all. Thank you.
Thank you. May I call on Republic of Korea, followed by Samoa.
Thank you, Chair. Dr. Tedros, Dr. Jacob, ministers, delegates, colleagues, ladies and gentlemen. The past year has been critical in getting the implementation of the Sustainable Development Goals, GPW 13, and the WIPRO for the Future vision back on track while overcoming the adverse impacts from the COVID-19 pandemic. Thanks to its excellent initial response and high COVID-19 vaccination rates, the region has recorded low mortality rates compared to other regions. In addition, we note the progress made in various support areas, such as establishment of emergency medical teams, healthcare innovation through comprehensive use of data, establishment of policy for child health promotion, and the expansion of essential healthcare. We express our deep and sincere appreciations to the Acting Regional Director and the Regional Secretariat, as well as the country office staff members for their hard work during such a difficult period. The past 3 years of COVID-19 pandemic response has taught us that the entire world needs to boost medical response capabilities and bolster access to medical countermeasures in order to effectively deal with global health crises. I believe that investment in building a more responsive and resilient health system is required to meet the SDGs, including UHC by 2030. In this context, the Republic of Korea will be actively engaged in the ongoing process, including but not limited to the negotiations on the pandemic treaty and the IHR revision, as well as the work to implement the Asia-Pacific Health Security Action Framework to be adopted at this RCM. At the same time, we would also like to highlight our strong interest and intention to work closely with the Secretariat to successfully operationalize the Regional Innovation Strategy for Health. We feel it will contribute to strengthening the entire spectrum of health architecture in the region. To conclude, I would like to inform you all that Korea will be hosting the second World Bio Summit in Seoul under the theme of the future of biohealth in November. I would like to convey my sincere appreciations to the WHO for their support and participation in the upcoming event. The Republic of Korea has been and always will be committed to strengthening healthcare capabilities in the Western Pacific. We kindly request member states to join us in this effort. Thank you.
Thank you. My call on Samoa, followed by Australia.
Mr. Chairman, Honorable Ministers of Western Pacific region, especially Honorable Regional Director, Director General, Dr. Tedros, also the Regional Director for the time being, especially the last time, Dr. Susan Jacob. I am very pleased to give this statement on behalf of Samoa government to heartily acknowledge the very comprehensive report by the Acting Regional Director of our region, Dr. Susan Jacob. Samoa is grateful for WHO Regional Office support for financially and technically in strengthening its health system and enhancing the provision of health services that are needed for promoting the health and well-being of our people. Every division of the regional office had made huge contributions to Samoa health system through, one, strengthening our health security system and public health emergency preparedness and response. Second, public health surveillance and laboratory services. Third, strengthening our health systems to achieve universal health coverage and health-related sustainable development goals. Fourth, NCDs, NTDs, and infectious disease control and management. Five, strengthening our health information and communication systems. And six, strengthening leadership, governance, and administration in terms of formulation and implementation of health policies and strategies, improving health facilities, and enhancing the capacity of health workers, to name a few. Samoa remains committed to work closely with WHO Regional Office and our country office in ensuring all our activities and programs supported by WHO are implemented in timely manner with expected qualities. To conclude, Samoa would like to heartily congratulate the Acting Regional Director, Dr. Susan Jacob, for her dedicated leadership in the past 7 months. It was not long before you were stood at the helm to steer the region, but your effort is noteworthy, in particular, post-COVID-19. You are such a great leader, and I believe one of the Samoan proverbs suits you well. It says, women achieve excellencies. You did great works and achieved many. May God's blessings be upon you abundantly and the family. For our region, I pray for God's blessing to be with us. May He help us generate good thoughts and innovate new ideas that will help us in developing strong and sustainable health systems that promote health and well-being of our people. Before I end my speech this afternoon, also I would like to express sincere gratitude on your appointment, Mr. Chairman, for this 74th session of the Regional Committee meeting for WHO Western Pacific region, especially the appointment of your new group and members of your region committee for this time. So may God bless you all, and may you have a good and strong for the work. Thank you very much.
Thank you. My call on Australia now, followed by Tuvalu.
Thank you, Chair. Can I thank the outgoing Chair can I welcome the new chair, although I note I have lost my seat buddy beside me. Can I also welcome the new vice chair, and can I thank the DG and the acting RD for their comments. One of the key outcomes of this meeting, but not the only outcome, is the election of a new regional director. We really welcome the nomination of 5 experienced candidates. As the DG and the outgoing chair noted, really pleased the region has been able to introduce some new and useful features to the election process. As we discussed in the executive board in June, the focus on governance and a commitment to transparency and merit-based selection of leadership is crucial to the WHO. Very encouraged to hear the DG talk about reforms to be considered more broadly. As others have said, it will be important for Wipro to have stability in its leadership, and the new regional director should build on progress made by Dr. Jacob to support staff and deliver strong outcomes for the region. Turning to some of the comments earlier this morning, we value the DG's comments and your commitment to strengthening the WHO and implementing the reforms to WHO's operating model, financing, workforce and culture. WHO must be agile and responsive to increasingly complex health challenges, adequately and sustainably financed to fulfill its mandate, and be responsive to country needs with well-resourced regional and country officers. Although aspects are still with us, we encourage regional partners to act on lessons learned from the recent pandemic to position WHO and the international community to respond effectively to future pandemics. Join some of the comments made today of member states to maintain the momentum necessary to meet the May 2024 deadline for the treaty and the IHR. Participation of this region is important to that outcome. We want to work together to deliver enhanced health emergency prevention, preparedness and response in our region, including addressing gaps in our region's preparedness. We also need to address misinformation proactively. Turning to coming challenges, as others have also noted, can we highlight the impact of climate change on health, especially for small and developing states? Australia is working in partnership to address this issue and is keen to assist the region's efforts. NCDs remain with us as a leading cause of death and disability in the region. We recognise the adoption of the UHC high-level political declaration at the September UN General Assembly and acknowledge significant work remains to achieve UHC, given COVID-19 exacerbated many financial hardships. It is important the region increases investment in primary healthcare to avoid backsliding on some of those pre-COVID gains. We also hope to see a strong focus on digital health as an enabler in the next global program of work. Recognise digital health solutions need to be supported by strong foundational elements, security and privacy, coupled with digital health literacy. Finally, can I also add Australia's thanks to Dr. Jacob for his stewardship, and that's a word we use with due regard. As Acting Regional Director, have greatly appreciated your strategic, pragmatic, experienced and energetic approach to this important role at an important time for the region. Thank you.
Thank you. May I call on Tuvalu, followed by Palau.
Honourable Chairman of the 74th RCM, Director General Dr. Tedros, Acting Regional Director Dr. Susan, distinguished delegates and participants, ladies and gentlemen. Allow me at this juncture to congratulate you, Chair, for your election as the current Chair for the 74th RCM meeting. I extend our sincere appreciation to the Acting Regional Director, Dr. Susan, and her entire team for compiling and sharing with us this very comprehensive report. It does reflect the direction, achievements, and what is currently taking place in the Western Pacific region. Moreover, I would also like to acknowledge Director General's efforts in taking health issue into another level, as he pointed out in his statement this morning. The Regional Director report does reflect and in line with what we are also facing and trying to improve in Tuvalu. The importance of improving patient health information system is something that we're currently looking into it, but trying to do away from paper-based systems and to include a more functional digital patient health and information system. We're currently in the process and working closely with Beyond and Sensor Systems, trying to determine some of the best possible solutions to that. This year, we faced 4 disease outbreaks. And during these outbreaks, it really tells us how vulnerable our health systems are. The inadequate of the human resources have professionals on the ground to deliver and provide the service in time as such is well seen and well noted. This was mainly due to a high attrition rate of health professionals. And in our efforts to counter that, we're now in the process of increasing the number of health professionals we send to train in the various components of health system. In November 2022, we had our first community COVID-19 outbreak, where we worked very closely with WHO and our donor partners to assist with our response. We are so fortunate to receive support from WHO through technical teams and the FEMET from Fiji to assist and lend us support during the outbreak. We face many health challenges, such as the escalating non-communicable diseases and the increase in premature death in our population strongly indicated the need for more actions and investment in primary health care through public health. As a means of countering these challenges, we have revived and in the process of increasing our funding support to NCD activities and our primary health care as a whole in the country, building capacity of those who are involved in NCD programs and many more. The existential threat of climate change poses health risks to individuals. As I alluded earlier, we already had 46 outbreaks this year, and some of these diseases are well connected to climate change. We are so fortunate to receive funding support to create and build more resilient health system to counter all of these challenges, as it does implicate the livelihood and well-being of individuals. The prevalence of communicable diseases in Tuvalu, such as tuberculosis, is something that requires the Ministry of Health urgent attention and the need for more collective effort from people to counter these changes. Mr. Chairman, I take this opportunity to sincerely extend our government's sincere gratitude to WHO, SPC, UNICEF, UNFPA for providing effective support and technical guidance for member states, in particular Tuvalu, to be able to respond effectively and efficiently to the various outbreak uncertainties. I'm also indebted to all our donors and development partners from our region and around the world for technical and financial support they had rendered in terms of human resources, medical equipment, and the provisions of vaccines. Lastly, to the Division of Pacific Technical Support Team in Suva, Fiji, WHO office, thank you for the ongoing timely support offered to Tuvalu. I wish the 74th session of RCM fruitful and successful discussion. I thank you, Mr. Chair, for the opportunity.
Thank you. My call on Palau, followed by Solomon Islands.
Thank you, and good afternoon, Honorable Chair, Director General Dr. Tedros, Acting Regional Director Dr. Jakob, Honorable Ministers, distinguished delegates, ladies and gentlemen. Take this opportunity, first and foremost, on behalf of Palau, to congratulate and thank the outgoing chairperson of the 73rd RCM for his commendable leadership over the past year, and further congratulate Lao People's Democratic Republic for their achievement in eliminating LF. Also wish to congratulate the incoming chair and all of the officers of the 74th Regional Committee. I look forward to working with you in the coming days as we deliberate our regional efforts. We'd also like to express Palau's deep appreciation to Director General Dr. Tedros for his steadfast leadership throughout the COVID-19 pandemic and for his ongoing guidance as we and the world navigate through emerging and re-emerging health issues, including the devastating effects of climate change, conflicts, and inequities throughout the world. We also express immense gratitude and gratification to Dr. Susanna Jakob for the leadership, engagement, and commitment she has afforded the Western Pacific region in her role as the acting regional director, including her participation of the 15th Pacific Health Ministers meeting recently concluded in Tonga. Further convey our deep appreciation to all the hardworking men and women of the Western Pacific Regional Office for their diligence and work with member states. Palau also welcomes the detailed report presented by Acting Regional Director and the Secretariat this morning, which signifies the exceptional work of the Regional Office throughout the course of the past year. We'd also like to congratulate WHO on its 75th anniversary this year, and to acknowledge and commend the exceptional work and progress it has achieved in the improvement of lives of the past 75 years. Lastly, I wish the best of luck to all of our candidates for the regional director position. and state Palau's commitment to working with the new regional director to further enhance and strengthen our efforts in the Western Pacific region. Look forward to our deliberations this week on essential regional initiatives and wish for all a productive and successful 74th Regional Committee meeting. Thank you, Chair.
Thank you. May I call on Solomon Islands, followed by Fiji.
Thank you, Honorable Chair, honorable colleague ministers and your delegations, ladies and gentlemen. Firstly, allow me to convey my sincerest congratulations to you, Honorable Chair, for your appointment, and also to the outgoing Chair. And also let me convey my sincerest congratulations to Dr. Jacob and your team in the regional office for the detailed annual report, which marks your final one as the acting regional director for the Western Pacific Regional Office. Acting Regional Director, may I commend your exceptional leadership in taking the Western Pacific Regional Office in the face of so many challenges and adversities, and a region that is further faced with such complexity in the current environment. Yet I am pleased to see encouraging and unprecedented signs of progress in the efforts to ensure that the Western Pacific region is the healthiest and the safest for the future. Solomon Islands would like to take this opportunity to thank WHO for its technical and financial support for the following items in the past years: the drafting and launching of the National Health Strategic Plan 2022 to 2031, the launching of the mental health policy, disability policy, rehabilitation strategic plan, and ratification of the Convention of the Rights of People with Disability. Revision of the Health Service Act, Public Health Emergency Bill, and Nursing Council Act. Digital health strategy, supporting for the improving of the district health information system and other data platforms. The review of the health workforce, revisiting the primary health care framework and the role delineation policy. Your support for the NCD policy and on-the-ground improvements to address this worsening NCD pandemic in my country. Improving clinical governance, strengthening infection prevention and control from governance to on-the-ground implementation. Your continuous support in pandemic preparedness, prevention, and response. While we have made remarkable significant achievements that WIPRO and its member states should be proud of, NCD and mental health will continue to be our key challenge and country priority. At the same time, new diseases are being faced and old diseases reemerging. As resilient as the Western Pacific region is, let's stand united to face the biggest crisis of our lifetime. And there is more we can do together. Lastly, I would like to thank Director General Tedros' strong push to make country core presence predictable and sustainable. Honorable Chair, I thank you.
Thank you. May I now call on Fiji.
Honorable Chairperson, Acting Regional Director, honorable members of this forum. I wish to firstly congratulate you on your appointment as Chair of the 74th session of the RCM for the Western Pacific region, and also congratulate the Vice Chairperson on her appointment. And on that note, I also wish to congratulate and thank the outgoing chairperson. I also wish to acknowledge and thank our acting RD, whose steady hands and determination has guided our region through a challenging period to where we are today. At the doorstep of welcoming our newly elected RD. Renata Vakalewu, Madam, for your contribution to health in the Western Pacific region. We acknowledge and thank the Secretariat for the report on the work of the WHO in the Western Pacific region in the period of 1st July 2022 to 30th June 2023. The last 12 months have indeed been momentous for the region, which witnessed, amongst other things, the change of leadership to our current acting RD. As members of the region, we must own these issues, learn from them, and move forward with greater determination to improve the health of our people who look to us as the custodian of health for our people. We acknowledge the support of WIPRO and the Pacific Technical Support Division towards member states, particularly small island development states like Fiji, in addressing our urgent health needs. We look forward to working closely together in the next 12 months. Fiji wishes to acknowledge and thank all member states who spoke and voted for at the 75th World Health Assembly in Geneva early this year in support of the establishment of the Voluntary Health Fund for SEEDS. The fund will assist to reduce the financial burden on SEEDS member states to attending to their WHO obligations, and this has added another feather of achievements to this 75th anniversary year of WHO's existence. For Fiji, we had a change in government in the last 10 months, which I was appointed as Minister for Health and Medical Services under the new coalition government. NCD, climate change, universal health coverage, and primary health care remains among our top health priorities, and we look forward to the support of the WHO and our regional partners to tackle these health challenges as well as emerging critical health needs. To conclude, Fiji is concerned with the impact that the new conflict in the Middle East will bring to the health challenges we are already facing with the Russia and Ukraine war. We call on WHO and our regional partners to assist us to be able to mitigate the impact of these conflicts on our access to medicines, medical equipment, consumables, and medical supplies that we need for our populations. And I thank you.
Thank you. Are there any other more representatives who wish to speak on this topic? If not, I understand that there is a representative of a UN agency who wishes to make a statement to the committee on this agenda item. It is my pleasure to call on the representative, the International Atomic Energy Agency, IAEA, to deliver a short statement to the regional committee.
Thank you. Honorable Ministers, dear Chair, distinguished delegates, Honorable Acting Regional Director of WHO, Honorable Director General of WHO. The International Atomic Energy Agency is mandated to enhance the safe, peaceful, and secure application of nuclear science to support countries achieving the Sustainable Development Goals. The agency helps with access to technologies that contribute to quality healthcare and strengthening capacities for prevention, detection, and treatment of a range of diseases. In cancer control, the IAEA supports countries to improve access to radiotherapy, diagnostic imaging, and nuclear medicine to be delivered in a safe and quality manner. With our key partners such as WHO and IRC, the IAEA works to assess capacities and integrate radiation medicine into national cancer control plans. Since 2005, we have conducted cancer assessments in Cambodia, Fiji, Laos People's Democratic Republic, Malaysia, Mongolia, Papua New Guinea, Philippines, and Vietnam. Within the last year, the three agencies conducted follow-up reviews in Cambodia, Fiji, Laos People's Democratic Republic, and Papua New Guinea. Many countries in this region have challenges in access to quality cancer care. Through the IAEA flagship initiative called Rays of Hope, we provide support through needs assessment, training, expert advice, and equipment procurement. Rays of Hope has strong WHO support and aligns with its key global cancer initiatives. Distinguished delegates, this region is also facing malnutrition burden, and slight progress has been accomplished towards global nutrition targets. Stable isotope techniques generate accurate data for evidence-based planning, and now 12 countries in this region have capacity in using those to monitor breastfeeding practices and body composition. Ladies and gentlemen, the COVID-19 pandemic had an impact on the health system. From the outset, the IA has been delivering diagnostic and protective equipment to the region with related training. In follow-up, the IA launched the Zoonotic Diseases Integrated Action called Zodiac initiative aimed to strengthen preparedness for future pandemics. This initiative builds capacities in surveillance, early detection, and control of zoonotic diseases. In conclusion, the IA is committed to enhance current and pursue new regional partnerships and work together with WHO and partners to support our member states. I thank you very much.
Thank you. May I now call on the Acting Regional Director and the Director General to respond to the points that have been made.
Thank you very much, Chair. Excellencies, Ministers, ladies and gentlemen. First of all, on behalf of the staff of the regional office, let me thank you very warmly for all your support. And obviously, your continued support to this office will be crucial in the years to come. I'd like to thank you also for your leadership in your countries, which has been amazing. And jointly, we have achieved a lot during the last years, last decades, and this is what we should continue to do. We noted all the issues that you raised in your statements, and we will continue to work on these issues. They cover a very large area of work, like health security, which is a priority, and it will come as a strategy to this regional committee for adoption. But of course, tonight you will also see how we want to further engage this region on the work that is going on in Geneva on the pandemic accord and also on the IHR renewal. Then the resilient health system based on primary health care towards universal health coverage is an outstanding priority, and we will take into consideration the recent outcome document or recent political declaration that came from the UNGA, but also the G7, G20 discussions that have taken place on this topic beyond World Health Assembly, Executive Board and regional committees. We will also continue our disease-specific work and focus a lot on the healthy population also, particularly on prevention, health promotion, and all the health determinants. And you have raised many of these success stories from your countries, for which I'd like to thank. Then the climate change, the digitalization, and some other priorities, these are all issues that unite our region, and therefore we should continue to work on them. We have most of the global and regional strategies in place to guide our work. Some of them will be approved by you, hopefully, and I'd like, of course, we have to wait and see until the item is on the agenda, but hopefully some of them will be approved during this regional committee, like workforce, like the work on the health financing, like the health security regional framework, like the innovation strategy, the communication for health work, and these will all have impact on what we do and how we deliver. But what I'm saying is that we have the knowledge of what we need to do, and we have to focus now on the implementation. And this is why it is so important that the Director General took this initiative to strengthen the country work, the country offices, for more impact and more results in the country level. And this investment that he gave to us, the 18.7 million, which allows us to set up additional 54 positions, core positions in the country offices, will help us to move into this direction to improve the impact. And you raised some issues, like the Honorable Minister from Kiribati raised the issue of statistic health information data. I fully agree with him that this needs to be strengthened in your country and also in some other places. But this needs additional capacity, and now we have factored this into the additional HR plans that we will develop for the country offices for the next biennium. And this takes me to the issue of results, monitoring results and monitoring impact in the countries, which is absolutely key. This was also one of the transformation initiatives of the Director General, and we have developed a very good global framework for this, both the result framework, which was approved by the World Health Assembly, and the impact for delivery work. And this is the time to institutionalize it in every part of the organization, including regional offices and country offices. And now that we have the additional capacity for data collection and monitoring and reviewing the results, this may happen. And I think this will take us to the next stage, because that will help us really to monitor the results and impact at the country level. And obviously the link between the GPW 13 and GPW 14 will also be crucial in this regard, because before we institutionalize this result framework, we also have to see what changes are requested by the outcomes and by the outputs that will come with the GPW 14. And then my final comment, Chair, is that the work to support the staff and the dialogue with the staff that many of you raised will have to continue, and all the initiatives that we have started on the cultural and behavioral change, including the work on the sexual misconduct. And as I said earlier today, we will do as much as we can in the next 4 months, but then we will hand over a more medium and long-term action plan to the incoming new regional director, and we will also discuss it with him or her as soon as he or she takes office. And it will be a very important piece of work also to continue with the initiatives and also with the positive management style to support the staff in the organization. And I think these are the most important issues I wanted to raise. You raised many others, and we took note of them. And thank you for them. And I'd like to assure you that we will follow up on everything that you have raised. And thank you again for your great support. Thank you.
No, thank you. Thank you very much for the comments, for the guidance, and for the recommendations. As Susanna said, we have taken note of all the comments and guidance you gave, so we will follow up on those. I will comment on few of them. Number one, I would like to thank all of you for your kind words for Susanna. I'm not surprised because when I appointed her, I know her capacity, her experience. She used to be the regional director for Europe, one of the difficult ones, by the way. And then she was a deputy director general. She is still, by the way, occupies that place, not vacated yet. I was not, I was expecting really the same. And I'm really glad you witnessed that. Of course, when she was appointed, there were some skeptics, but I told them, give her a chance. She will do this. And I told them she is excellent. Of course, there is skeptics in everything. But I was not really worried, and I was actually confident that she would do it. And there were two important things. One, the experience, as I said, and the capacity, and so on. And as an individual, I mean, she can work with people. She's very pleasant to work with. And the relationship she builds with countries. But on the other hand, I saw that. And the second part was, because of the challenges that were happening at that time, having a neutral person was better, because there were perceptions that were not helpful, just that were circulating here. And whoever you put from inside, because of that perception, there could be a bias saying, okay, this person is doing this because of this person, because there is some internal unnecessary frictions then. So having someone from outside would help. So these were the two reasons. One, she is capable. Second, having someone from outside was, of course, for me, sending out my deputy was a loss. But at the same time, this is a very important region, and we have to give our full support. And that's why I wanted to give you our full support. And I wanted the region to really stabilize as soon as possible. So she did great. And I can see the recognition from you, and I'm very happy that you are satisfied. At the end of the day, it's your satisfaction that matters, because we're here to serve you. And then on the other issues, one, the key one now is the strengthening our country offices, because we want our country offices really to lead from the front, to be empowered and decide. They cannot be just messengers of the headquarters and the region. And they should be able to take risk. They should be listening to you and help you based on your priorities, because you know the problems of your respective countries, and you know the root cause of the problems, and you know the solutions. And our country office heads can really help you based on your interests, and that's what we're trying to do. And not only empowering them, we're also making sure that resources follow that, because if you want to have change at the country level, okay, you can have personnel, but without resources, it won't move. So we are also giving it a priority in terms of funding, and we have allocated from whatever we have now, but the future is even more, what do you call it, hopeful, because you have decided during the assembly to increase our assessed contribution and to increase also our funding through the investment round that you have agreed, of course, conditional upon what we present to you during the board meeting in January. So that will be a game changer. Increase in assessed contribution and increased funding through investment round means more predictable, flexible, and long-term funding. That means it can be used based on the priorities of the countries. The problem we have now is more than 80% of the funding we get is voluntary contribution and earmarked. And that means strings attached. And that means we cannot use it based on country priorities even. We just use it based on what was agreed when the funding was coming. And in 7 years, 5 to 7 years, I hope the organization will be significantly different. That's why we have been working with you for the last 6 years. It took 6 years, by the way, to agree on the increased assessed contribution and investment round. And the assessed contribution increase is not small. In the organization's history, the highest increase in the past was only 3%. Now it's 50%, of course, over 5 to 7 years, and the 20% in one go. This is significant. And I would like to use this opportunity to thank you. But this commitment should be honored, because most of this funding will go to the country offices and would strengthen country offices, helping countries based on their priorities, because it's flexible and we can send it in a lump sum to wherever we want. So it can be used based on country priorities. You can see how this funding will address the systemic problem that we have. It's a strategic solution to the problem we have been facing, the earmarked and less flexible funding that was not helping us in helping countries based on their priorities. So this is a big deal. The other important element in here is this movement, this change, this transformation is being led by the country office heads themselves. The one question I asked them when we started this change is, tell us what you want in order to do your job with full empowerment. Just give us. that's something that can help you to be empowered. And so you're leaders in your own right, a better environment so that you can change things. And from then they came up with 10 issues. The progress is good. And we hope we will make sure that it succeeds. But your continued support, especially with the financing, is important. It's now honoring the pledge because that will help us to address the strategic problem I told you. And then the other issue, maybe I would like to, I think on climate and health, focus on citizen initiative, hear you, on workforce, on information, on non-communicable diseases, focus on healthy populations, on promotion and prevention. I think we agree on all of them, and I don't want to repeat. And also the 3 high-level meetings, especially the pandemic preparedness and response, universal health coverage and TB, how we translate the declaration into action. All these are clear, and also the respectful workplace, continuing to invest on that. All these are important, and we will implement them accordingly. But I have 2 things which are very important. One, the climate and health. There is the UAE meeting. UAE for the first time has allocated a day, which is actually during the prime day, the 3rd day of the conference, for health and climate. I think your involvement will be very, very important. I have been to many SIDS countries in this region, more than, I think I know probably more than 70% of them. I know in what condition you are. Okay, the whole world talks about climate, but you're disproportionately affected. And your voice, I think, should continue to be heard. And if you can participate fully and in big numbers would be good, and would be happy to look for resources. I know it's very difficult for you to travel all this distance, but your participation, full participation, will be important. And please join. And then if you have any ideas, also suggestions to contribute for the success of the forum, please feel free. In addition to ministerial discussions, we want the ministerial meeting to be opened by heads of state, heads of government, and those who attend the COP, I think from our SIDS countries, if they can at least open the ministerial meeting, would be helpful. If we have the presence of heads of state and heads of government, and if there are willing heads of state, heads of government from your side, if you let us know, then we'd be happy to accommodate them at the opening, so they can grace the opening of our ministerial session during the summit. But this will be a very, very important opportunity. So the other is the second one is on especially the transition that Susanna said. I kept that to the end. Many initiatives now coming up. So supporting her, especially during these 4 months, to speed up the process will be very, very important, because there are many initiatives that are good ones, and they have to be, if not concluded, but at least strengthen them so the continuity can be assured. So with that, thank you so much. Very glad to be with you, and I wish us a successful regional committee meeting. Thank you.
Thank you to Dr. Tedros and Dr. Jacob. It's now time for our coffee break. The plenary session will reconvene in 15 minutes. Thank you very much.
Thank you.
Thank you.
Thank you. I went and
Thank you, DG. Thank you. Thank you, Chair.
DG. Some people,
Good morning.
you know what they call?
and join as the Global Scrub Choir leads the mobility break. Thank you.
Okay. I hear this is a tradition here, so come on, let's get up. Up you get. Start for your mobility break. Olivia will be leading you through the moves. Okay, are we ready? We are family. I got all my family with me. We are family. Get up everybody and sing. Let's do it together. Again. We are family. Ooh, yeah, yeah. I got all my family with me. We are family. Get up everybody and sing. Now some stretching. Just to the side there, nice big stretch. Oh, that's lovely, isn't it? And now back to the other side. Oh, that's gorgeous. I feel like a new woman. Reaching up and bend your knees. Oh. Reaching up and back to the chorus. Let's go. We are family. I got all my people with me. We are family. Yeah, you're getting it. Get up everybody and sing again. We are family. Ooh, yeah, yeah. I got all my people with me. We are family. Get up everybody and sing. Some more stretching. Let's roll our shoulders back. Oh, rolling your shoulders. That's lovely, isn't it? Oh, very nice. Let's forward. Roll them forward. Let's do that again. It felt so good. Back again. Ooh, and shake it out, everyone. Shake it out. Are you ready to do the chorus again? Come on. Last time. With all your energy. Go. We are family. I got all my people with me. We are family. Ooh, yeah, yeah. Get up, everybody, and sing. Last time. We are family. Ooh, yeah. I got all my people with me. We are family. Get up, everybody, and sing. Yeah. Thank you. Let's go. And we're off.
Well, that was great, wasn't it?
Excellent. We should do it more often.
All right. Okay. We now move to agenda item 9 on the program budget. You should have before you document WPR/RC74/3, RC74/INF/1, Program Budget 2022-2023, Budget Performance, Interim Report, and Program Budget 2024-2025, respectively. May I now request Dr. Susanna Jacob, Acting Regional Director, to introduce these agenda items.
Thank you very much, Chair, distinguished representatives. I am very pleased to present to you agenda item 9.1 on Program Budget 22-23, Budget Performance Interim Report, and also item 9.2 on the Program Budget 24-25 update. Document WebPro/RC74/3 and its annex provide an interim report of budget performance for the biennium 22-23 as of 30th of June 23. As you can see in this document, funding, utilization, compliance, and controls continue to be strong. Overall, for the Western Pacific region, we are projecting the utilization of 92% of the available resources of $362.7 million towards the end of the current biennium. The region continues to place a strong emphasis on the allocation of funds to country offices. As was the case for 2021 biennium, 2/3 of the funds in 22-23 have been utilized at the country office level. The region prioritized the implementation of base program activities, accelerating progress towards the 3 billion targets and those of the Sustainable Development Goals. We will continue building resilience across the region by strengthening primary health care and further improving response capacities to health emergencies. The Secretariat has no outstanding external audit recommendations. There remains only one internal audit recommendation that is open, which is the development, publishing, and dissemination of the WHO Country Cooperation Strategy for Papua New Guinea. The WHO Representative Office has worked and collaborated actively with the government to finalize the CCS. In fact, there will be the signing of the new CCS for Papua New Guinea, which will happen this week, along the margins of the RCM. The region continues to enhance controls through strengthened management, training, communications, including the monitoring of risks, particularly for donor reporting, direct financial cooperation contracts, and the procurement of goods and services. Gender balance and geographical representation of staff continue to be one of the top priorities for the region. In fact, significant progress in gender parity has been made through recruitment policy adjustments and awareness raising among staff over the years. The share of female international staff in the region had risen to 60% as of 30 June 2023. We will continue reaching out to unrepresented and underrepresented countries in the region to improve opportunities for successful recruitments, such as the holding of the region's initiatives in priority countries like the Go WHO workshops to attract talents by proactively working and targeting young professionals to bring fresh perspectives and a different way of thinking into WHO's work. In turn, the young professionals will benefit from the networks that they can build and tailored learning opportunities that will help them grow their careers and provide them the advantage to compete for long-term positions, whether in WHO or in other organizations. The annex to the document WebPro/RC74/3 contains the performance assessment of the first year of the program budget 22-23. It is a summary of the progress made against the strategic priorities and outcomes identified by the WHO 13th General Program of Work. Before moving to the next sub-item, I would like to share some highlights of our achievements last year. With your permission, Mr. Chairperson, I would like to give the floor to Mr. Arpit Agarwal, Budget and Finance Officer, and also Acting Director for the Division of Administration and Finance, who will present the financing figures and projected utilization of the current biennium, to be followed by Dr. Liu Yue, Executive Officer of the Division of Program Management for the Achievements in Countries. With your permission, I give the floor to Arpit first. Arpit, please.
Thank you, Acting RD. Distinguished members, the document WPR/RC74/3, Program Budget 22-23, Budget Performance Interim Report, contains status of financing and utilization as of 30th of June 2023. The slide shows the status of the financing and projected utilization as of the end of biennium. For the base program budget, as well as all the categories of the program budget that includes base, polio, and OCR, we anticipate reaching a strong utilization of 92% of our available resources by the end of the biennium. This would mean an overall utilization of US $312 million by the end of the biennium. At the start of the biennium, base program had polio transition budget of US $2 million and a separate polio eradication estimated budget of US $400,000. All the polio work in 2023 in the region was mainstreamed and implemented through base program budget, outcomes 1.1, improved access to quality essential health services, and outcome 2.3, health emergencies rapidly detected and responded to. As you can see from the projected utilization of US $312.2 million, by end of the biennium, we anticipate 66% or 2/3 of the funds to be utilized at country offices level, reflecting Secretariat's strong commitment to accelerate progress and impact in countries. Thank you very much, and may I hand this to Dr. Yue to update on the technical progress achieved last year.
Thank you, Arpit. The report in the working document is 66 pages long, but please allow me to use several minutes to give a glance about the outcomes of program budget under each strategic priorities of GPW 13 for the year 2022. Unprecedented economic growth, migration, and urbanization have created opportunities for better lives. But evolving lifestyles and changing consumption patterns have also increased non-communicable diseases, air pollution, climate change, and other environmental changes, which put people's health at risk. COVID-19 remained a continuing threat in 2022, making rebuilding basic health service a challenge. The report highlights how the Western Pacific region is working to address these challenges and to achieve impact at country level. Within Strategic Priority 1, Universal Health Coverage, new regional framework on primary health care, mental health, and cervical cancer are helping countries strengthen their systems. WHO helped Vanuatu become the first Pacific Island country to eliminate trachoma, reaching the most marginalized and hard-reached population. WHO worked with countries and areas to strengthen malaria surveillance systems and improve the quality of care for the highest risk populations. A broader and integrated approach to prevent and control the infectious diseases is reducing the impact of these diseases. A WHO Facebook campaign on kangaroo mother care attracted over 51 million views, and the updated early Essential Newborn Care Pockets guide was used by 9 priority countries to help scale up these practices. WHO also facilitated regulatory approval of COVID-19 vaccines and provided guidance on novel treatments. Within Strategic Priority 2, Health Emergencies, WHO is helping member states become operationally ready to address imminent risks from all emergency threats. Country-led COVID-19 interaction reviews were conducted to analyze gaps and needs in strengthening preparedness, readiness, and response to public health threats. Through WHO training and advice, member states have rapidly expanded their genomic sequencing activities to meet surveillance and laboratory testing challenges for current and future pathogens. In 2022, emergency capacities were tested by new waves of cholera, COVID-19 infections, dengue, mpox, typhoons, and volcanic eruptions, etc. Emergency medical teams were deployed and expanded throughout the region. The Tonga Emergency Medical Assistance Team provided aid to the hardest hit islands of the volcanic eruption and tsunami. Within Strategic Priority 3, Health and Well-being, WHO is empowering individuals, families, and communities to make more informed health decisions. Policies and guidance are being developed and updated with member states to integrate One Health approaches, reduce demand for alcohol and tobacco, and improve deaths. WHO supported member states to implement the regional framework on nurturing resilience and healthy future generations in the Western Pacific, and helped member states to strengthen their national nutrition policy, strategy, and action plans to improve maternal, infant, and young child nutrition. The regional office published a step-by-step guide for healthcare facilities on antimicrobial resistance. A WHO checklist helped member states reopen schools after COVID-19. The regional office also supported the integration of gender-based violence prevention measures in quarantine centers to ensure the safety of returning migrant women. Within Strategic Priority 4, better support to countries, WHO is incorporating advancements in data and innovation. Working together with member states and partners to strengthen leadership and governance, effectively managing human and financial resources that are fit for purpose. With commitments and support from all our partners, we've been able to accomplish so much. Our strength is also in the diversity among our 37 countries and areas. Working together, we can make our region much healthier and safer. Thank you very much. And may I hand over to you, Acting RD. Thank you.
Thank you very much, Arpit and Yue. And ladies and gentlemen, now turning to the program budget 2024-25 update, I would like to present the information document RC74/INVDOC1. The Global Program Budget 2024-2025 is the third and last WHO program budget under the 13th General Program of Work, which was extended to 2025 through Resolution WHA 75.6. Program Budget 2024-2025 was approved in May 2023 through Resolution WHA 76.1 with a 20% increase in assessed contributions from the approved levels of 22-23. This increase marks a historic move towards a more empowered, independent, and sustainably financed WHO. To further drive impact in every country under the core predictable country presence model, 54 core gap positions in the region were identified, all in countries, for a total of $18.7 million funding need. Thanks to the Director General, who has placed very high priority on this matter organization-wide, funds transfer is fully approved and funds will flow to country offices during this week. The positions are included in the region's 24-25 operational planning, with recruitment slated to begin this year. The document shared with you presents the highlights from the global budget, including those in the context of the Western Pacific region and its For the Future vision. It also presents an overview of the regional budget for the coming 24-25 biennium. Details can be found in document RC74/INVDOC1 on Program Budget 24-25. Member states are invited to review the documents and provide guidance and comments to the Secretariat. With your agreement, Mr. Chair, I will now invite Dr. Imre Holló, Director of Planning, Resource Coordination, and Performance Monitoring from our WHO headquarters to take the floor. Dr. Holo will present the overall program budget 24-25 global perspective, to be followed by ARPIT for the region's overall budget, and Dr. Rodel Nodora, Acting Program Development and Operations and Country Support Unit of the Division of Program Management, for operationalizing the program budget. Imre, you have the floor. Thank you.
Thank you very much, Marty. Good afternoon.
Maybe I should
Yes.
switch it off.
Thank you very much, Acting Regional Director, and good afternoon, everybody. Can we go to the next slide, please? What I would like to talk about is an update on where we are with the program budget 24-25 development since what happened since May 24 when you approved the program budget. This first slide is just a reminder that our total program budget is 6.8 billion if we look at all the 4 segments, and 4.9 billion, almost 5 billion, if we only look at the base segment of the program budget. From that, Wipro's share is 8.2% of the base segment, with a $408 million allocation, and 6.3% of the total budget, with a 430 million allocation from the 6.8 billion. You probably also remember that this is the overall budget in the base segment represents a 0 budget increase, but there's a slight increase for the regions, as you've seen it from the previous slides from ARPIT, and there's a decrease in headquarters. And this is the first program budget where almost 50% of the resources, the planned resources, are allocated for the country segment. Having said that, you also know that the budget is not funded, and it is still our biggest challenge, and we'll talk about that a little bit later when we come to the AC increase and the investment round, to make this budget a reality. Next slide, please. So there were 3 elements that we've been focusing on in moving forward after the budget has been approved. The one was to finalize the country work based on country prioritization, and to bring it down into what it requires in terms of HR, staffing, and activities. With a very strong commitment that for the first time there's a commitment from the Director General and from our Secretariat to fund the prioritized outputs by budget centers, so it means by country offices, at least at 80%. The other big element was that the Acting Regional Director already referred to, is the development of the country core predictable presence model, which I will talk about a little bit later as well, which has significant increases in staffing at the country offices in the coming weeks, hopefully, if not, then the coming months for the Wipro region. And lastly, we've been working on towards more adequate levels of sustainable financing. And here there are 2 elements. One is that we have pledged certain commitments and key performance indicators for the AC increase that we are working on to implement. And there's, of course, the investment round, which my colleague Lynn is going to talk about a little bit later. Next, please. In terms of prioritization, 27 Wipro member states participated in the prioritization process, and the results were pretty consistent in the regions in terms of what were the outcomes that were prioritized. And you can see that three outcomes, the improved access to quality essential health services, countries prepared for health emergencies, and supportive and empowering societies, so addressing health risk factors, have come out as the sort of leading prioritized outcomes, which is very much in line also with the global prioritization. Next one, please. As you also know, that the outcomes measure our joint commitment, and the outputs is the work of the Secretariat. So it's also important to see where the countries saw they would like to work most with the Secretariat, and which are the outputs where they prioritize the work of the Secretariat. And also very much in line with the outcome prioritization, the countries enabled to provide high quality, people-centered health services, strengthening capacities for emergencies preparedness in countries, and addressing risk factors were the top three areas where countries asked for support from the WHO Secretariat. Now we move into operational planning, and we're working closely with our colleagues here in the region, where we translate this into HR activities to define what is the proper composition that is best suited to provide the help that was requested by the countries. Next one, please. So, as you also heard from the DG, but also from the acting regional director, is that strengthening country capacity and driving impact in every country has been the focus of the past couple of months of work. There was a big meeting in December where all the heads of country offices, together with all the top management of the organization, got together, and they came up with a long list of recommendations. And the Director General said, okay, we had many of these meetings, but now I really want this to be a reality. And as a result, he put together, and he mentioned that in his speech, an action results group, ARG, where there are representatives from every region in this group, also from this region. The WR from Malaysia is representing the region, and I saw him earlier here. And they came up with a list of actionable items coming starting from resource mobilization to staff mobility, improving bottom-up planning processes, increased participation of WRs in internal decision-making, delegation of authority, etc. So a long range of issues that are meant to make sure that whatever we do improves results in country offices. And one of the elements is this core predictable country presence, which looks at, based on epidemiological and disease profile country offices, and comes up with a model that is required from a staffing perspective to best address the needs of the country offices. And as we already discussed, we have started the implementation of this core predictable country model, and the WIPRO region is also benefiting greatly from this exercise. It is also important that there's been a discussion and a decision and a commitment that we will start as much as possible to strengthen the technical position to support the highly prioritized outputs of the program budget. So in that sense, there's a connection between the program budget outputs and prioritization, the commitments in terms of making them implemented, and the country core predictable presence model. Next, please. In terms of the overall financing situation of 24-25, we are already 47% funded. considering flexible funds and known projection of volunteer contributions. This is good news and bad news. This is slightly higher than what we have at this time of the year before we start the biennium, so it's good news. But of course, it shows that there's still 53% of the funds we still have to find, which obviously remains a challenge, particularly in those areas which we call pockets of poverty. So those areas which are not funded or have not been funded in the past from volunteer contributions. And we're working very closely with the regions and of course with member states to make that program budget a reality as much as possible. And I'm also quite convinced that the investment round is going to help as an innovation in that context. Next one, please. Just to remind us that we have established a number of KPIs to measure how well the increased SS contribution that Zsuzsanna referred to has made available to us will be used, and these KPIs we continue to report back to you on them and see how well basically they are met using the additional SS contribution. Next one, please. This is my last slide, and I just would like to remind everybody that on one hand, it is absolutely great that we have this 20% increase for the program budget 24-25. And I hope that we will be able to show you that we'll put this additional 200 million to good use, and it will be really concentrated on strengthening country offices. But the next AC increase, although there's a commitment in general that was made at the 75th World Health Assembly that the DG referred to, is not certain, is not in the bag, because the AC increase has to be approved together with the approval of the program budget. So this means that the next SS contribution increase will have to be increased in May 25 when the 26-27 program budget is approved. And for that, we have to define what that increase is going to be. What you see, that little table up there is taken from the 75.8 decision, but that was only indicative. So we don't have an agreed figure for the next AC increase. So that 35% is something that needs to be discussed. And of course, so we need to very quickly come to an agreement about the number, because we know that you will have to go back and discuss that figure with your relevant governments, ministries of finance, etc. And then, of course, we understand that in the current economic climate and with all the issues in the world, it will require the continued effort and support from the member states to bring that next AC increase to the table. So I just wanted to tell everybody that we can't lean back and assume that that 50% that the DG referred to will happen without the very active work and support of the member states. Thank you very much.
Thank you, Imre. So we will have two parts on Wipro's context of the program budget 24-25. Part one is the overall budget, which I will cover, and part two will be operationalizing the budget, which will be covered by my colleague, Mr. Rodell. So as you can see, for the coming 24-25 biennium, the region's total budget across the four segments of base program, polio eradication, special programs, and emergency operations and appeals is US dollar 430.2. And of the total global budget, Wipro's share is 6.3%. So this table shows the US dollar 4.9 million increase in the Western Pacific region's total program budget. And the increase is reflected across the outcomes in the Western Pacific's base program, with the percentage changes as compared with the program budget 22-23. And this is as a result of the bottom-up planning and budgeting based on the country prioritization. So for the Western Pacific region, it shows a 6% increase in the strategic priority 1 billion more people benefiting from universal health coverage, a 3% increase in the strategic priority 3, 1 billion more people enjoying better health and well-being, a reduction of 7% in strategic priority 2, 1 billion more people protected from health emergencies, and a decrease of 1% from strategic priority 4, effective and efficient WHO providing better support to countries. But the key member states is this growing country program. As you can see on this slide, the progression of the country program since 2000 to 18-19 shows a gradual increase of budget moving to the countries. For this biennium, the country program sees an increase of US dollar 8.7 million over PB 22-23, again reflecting our strong commitment to invest in and make greater impact in countries in alignment with the overarching objectives of PB 24-25. So with that, I thank you very much. And if I may hand over to Mr. Rodel Nodora now to discuss the part on operationalization of the program budget. Thank you.
Thank you very much, RP. Good afternoon again to everyone. So at this juncture, we would like to report to you the innovations that we are currently implementing as we develop the Secretariat's work plan for and operationalize it for the incoming biennium program budget 24-25. The approach that we are undertaking have been crafted in response to the global recommendation of the Action Reference Group of improving the bottom-up planning, as well as the region's initiative of simplifying the planning processes based on countries' needs and priorities. The highlight of the process involves the intentional strategic dialogues that will happen led by our country offices together with the targeted regional office programs to ensure a meaningful WHO response to countries' needs. If we can go back to the slides, building on the For the Future vision of the region, which all of our member states have endorsed, we continue to utilize strategic and relevant shifts that will further strengthen the support that we provide to all of the member states. As we continue to operationalize the For the Future vision, countries can be assured that everything that we do in the region are all aligned towards the achievement of the triple billion target of the organization, which all of us have committed to achieve by 2025. The main driver of our approach for the operational planning for Program Budget 24-25 will and have always been the countries and your priorities. WHO in the region will always ensure that we are engaged with countries that we serve who are also changing rapidly, not only of your health status and situation, but also on the overall economic, social, political, and development context. We continue to discuss with you and define the strategic deliverables where all of us will be committed and accountable to deliver by the end of the biennium. While at the same time, we will also endeavor to align our work in this region, which is detailed in the For the Future vision, to the overall 13th GPW, or the General Program of Work of the organization. We aim that at the end of the day, what drives our work plan and our budget are the needs and priorities of the member states. For the operational planning 24-25, we will continue to ensure that countries are at the center of our discussions. As we mentioned earlier, we aim to develop work plans that actually respond to countries' needs. We have implemented a 4-step approach of prepare, share, dialogue, and action. And with your indulgence, let me describe to you quickly our 4-step. Step 1 will be all about preparing. This involves the active preparation of both the country offices and the regional office. At the country office, we are expecting to identify the big ticket items that WHO will support the countries based on the needs and priorities of the countries. Country offices will also identify the priority programs that will be relevant to achieve those big ticket items. At the regional office, the preparation will consist of reviewing pertinent resolutions and other technical documents and other products and services expected to help the country's needs and priorities. The region is also expected to identify any international trends and innovations related to technical work of WHO that might be of relevance to the country's context. Once the above preparations are done, we are now into the step 2 of which involves the sharing of the findings and information between our country offices and the relevant programs in the region. We have also developed tools to facilitate the sharing of information as a family in this region. This step of sharing will allow the country offices and the regional office to come prepared for the intentional dialogue that will happen on the next step. This step, which is all about having intentional, strategic dialogue led by our country offices to ensure that the discussion will revolve around the identified big-ticket items based on country needs and priorities. The aim of this step is to generate an agreed list of support needed to be able to deliver on our commitments to the countries. This is to let all the countries also know that the country support that WHO provides comes not only from our country offices, but from the whole of WHO and its 3 levels. And once the strategic dialogues are done, country offices and technical programs in the region will now have a meaningful and directed approach in developing our individual work plans. This final step will integrate into our work plans the result of our strategic dialogues with a clarity on what kind of support and where the support will be coming from and when the support will be implemented, as well as monitored and reported. So based on our experience, what we have found out is that there seems to be a gap between our existing strategic plans, such as our country cooperation strategy, with that of our work plans developed during operational planning. So the very thing that is missing to bridge the gap is actually the strategic dialogue that should happen within us as your secretariat. WIPRO will continue to ensure that these dialogues will continue to happen on a regular basis, because we value the importance of having meaningful dialogues, because we know that the countries are changing rapidly and the needs and priorities of our member states also evolve with these developments. And as WHO, we will continue to strive to be with you through these rapid developments or even ahead in exploring innovative solutions that will impact countries. And as we ensure that our work plans respond to the country's needs through the four-step approach of repair, share, dialogue, and action, we will always consider the overall support to countries that we provide, noting the capacities of our ministries of health of the member states and where WHO can impact and add value from our country offices, the regional office, our headquarters, and not forgetting as well that we are not alone in this health journey and that we should also be working with our partners who are important players in providing the needed support that countries deserve from WHO. Thank you very much, and may I hand this over to our acting regional director. Thank you.
Thank you. Thank you very much, Imre, Arpit, Yue, Rodel. And now I will hand back to you, Mr. Chair. Thank you very much.
Thank you. Now we will hear from representatives who wish to speak on these items. We have a reminder that interventions on items 9.1 and 9.2 should be combined. Please indicate your wish to speak by clicking the big button on the microphone. I call on representatives of Philippines to be followed by New Zealand.
Thank you, Mr. Chair. The Philippines notes with appreciation the Secretariat's report on Program Budget 2022-2023 and for the next biennium. The performance and utilization for this biennium reflects the Western Pacific's concerted efforts to build back better after the COVID-19 pandemic disrupted the world's progress towards universal healthcare and health-related sustainable development goals. It highlighted intensified support to regenerate and reinforce health systems through primary healthcare orientation, as well as the shifts towards more sustainable WHO staff operations and management. The Philippines is one of the countries that piloted the GPW13 impact measurement system and has integrated its results framework in monitoring and evaluation of UHC. We believe that it should feature intense focus on expanding health emergencies, protection index indicators, and methodologies for smaller scale events in order to build local capacities to prevent outbreaks. Intensified WHO support in countries also entails tackling the uneven progress on SDG indicators to reverse the backsliding on progress towards UHC. It is important that the program budget 2024-2025 is anchored on stock-taking exercises to calibrate the budget for stronger WHO support for countries under social and economic recovery. For the Philippines, alignment of the budget's 5 priority areas should step up support for the 8-point priority action agenda of the country, which includes primary health care, people-centered services, including access to medicines, digital technologies, health security, determinants of health, mental health, and health workforce. We note that the regional office prioritized management and strengthening of direct financial cooperation mechanisms to enhance efficiency and improve productivity through stronger collaborations with governments. We pose that it considers other methods of implementation that could work effectively for countries whose financial regulations and limited systems would pose challenges in efficient implementation of DFCs. We look forward to a meaningful engagement with the Secretariat for the new country cooperation strategy for the Philippines, as well as in efficiently harmonizing development partner support through our digital tool, iDash, the International Development Assistance System for Health. Finally, we affirm our committed support to mechanisms for sustainable financing for the WHO, with our commitment to align investments to pursue greater public-private partnerships, digital health technologies, and focusing on health systems, including health workforce and supply chain management. Thank you.
Thank you. May I now call on New Zealand, please?
Tēnā koutou katoa, greetings to you all. Chair, Aotearoa New Zealand thanks the Secretariat for the presentation on the programme budget for 2024-2025. We support its overarching objectives to strengthen country capacity, continue work from the revised programme budget 2022 to 2023, and further strengthen accountability and transparency in the WHO's delivery in our region. Aotearoa New Zealand supports the 5 priorities pursued in this budget as appropriate to the health challenges we face as a region. Firstly, we are all striving as member states to promote health and well-being and prevent disease, but many of our countries require strong WHO technical support in this regard, including lower income countries and small island developing states, who experience the most intense vulnerabilities to climate change and other threats. Secondly, we support the emphasis in this budget towards reorientation of health systems towards primary healthcare. In Aotearoa New Zealand's experience, this is fundamentally important to the delivery of equitable healthcare for all people, including Indigenous populations. Thirdly, we believe it is vital that we double down on the need to strengthen the global architecture for health emergency preparedness and response, or PPR. As we have seen at the recent UN high-level meeting in New York last month, this pressing challenge remains unresolved, and governments must work together to conclude our negotiations on pandemic prevention, preparedness and response in Geneva by May next year. Aotearoa New Zealand is proud to co-chair the working group on amendments to the international health regulations, and we urge all regional member states to work together to meet this challenge. Fourthly, we agree it is vital that the WHO orients itself to leverage science, research, innovation, data and digital health technologies, and provides forums for member states to share and learn from the WHO and importantly from one another, so that we may all improve our delivery of healthcare, leveraging the latest scientific and technological advances. Finally, actions to partner for health by building a stronger WHO that delivers results as the world's leading health authority are critical for the health, safety and prosperity of us all. Ngā mihi nui. Thank you.
Thank you. And may I now call on China.
Thank you, Mr. Chairperson. There are 2 parts in my intervention. First, let me share with you the health investment in China and the UHC attainment in China. UHC is an important pillar of the 2030 Sustainable Development Agenda. China holds that health is an imperative requirement for human beings and the basic enabling condition for socioeconomic development. For our healthcare reform initiated in 2009, it puts forward a policy goal of establishing a government-led multi-layer health investment mechanism with the division of responsibilities amongst the government and other stakeholders. In June 2020, the law on promoting basic healthcare was proposed the establishment of a health investment mechanism relevant with economic and social developments. And it has become effective in the following ways. First, the total health expenditure in China continues to expand in scale and improve in structure. China's total health expenditure increased between 2017 and 2022, increased by 62%, accounting for a larger share of GDP from 6.32% to 7.05%. And non-government health expenditure also increased. And the household out-of-the-pocket payments dropped to 26.89%. It has decreased a lot. Secondly, we are improving equality in health investment coverage. We are stepping up fiscal appropriations in our public health expenditure. First and foremost, we consolidated urban resident and rural resident healthcare insurance schemes, making it one unified scheme. And we have established the world's largest medical insurance scheme covering 97% of urban and rural population of our country. And the government is constantly supporting investment in healthcare, insurance, and related expenditures. In 2023, the per capita investment grew by 640 RMB yuan, with 1,020 RMB yuan per capita. And government fiscal resources are playing a very important part in satisfying those needs. We have given full consideration to the underfunded situation in underdeveloped regions and communities in China. Throughout China, we have rolled out free of charge basic healthcare services, reaching 89 yuan per capita, supported by central government fiscal resources with a focus on underprivileged regions and areas in China. Thanks to all those efforts, the access and the quality of healthcare services in China have improved a lot. Average life expectancy in China is improving a lot as well, from 71.4 years in 2000 to 77.93 years in 2020. Other health parameters are increasing rapidly. Child mortality rate dropped from 3.02% in 2000 to 0.068% in 2020. The maternity mortality rate dropped a lot, now at 15.7% in 2020. Going forward, we will step up investment in primary care, making it well-funded and based with the high quality of services. National and regional healthcare centers will be established one after the other, so that funding will be provided to the grassroots level, and there will be more innovative forms in the rural areas to deliver higher quality healthcare services to our rural population. For part two, and for our utilization of the 2022-2023 budget and the report on 2024 and 2025 program budget, in general, we are satisfied with the effectiveness in the utilization of the budget in 2022-2023. Congratulations on the Secretariat for that. And for the program budget 2024-2025, we would like to endorse the overarching themes and activities. China would like to commend the efforts of the Secretariat on that. But we have three recommendations and suggestions. First, for the fund utilization for some priority categories, 2022-2023 was quite low. For example, for Area 2.2, pandemic prevention and control, the efficiency was only 26%, the utilization was only 26%. So going forward, I hope that could be a proposed solution to improve efficiency, well reflected in the program budget 2024-2025. Secondly, China is in agreement with the tasks and activities and overall themes of program budget 2024 and 2025. But we would like to suggest the supply of global public goods be expanded to bring better health to all populations in our region. It is a common aspiration by West Pacific and WHO in general as well. Thirdly, regarding the assessed contributions, we hope that in the proposed biannual program budget, there could be explanations on the necessary reforms that will support the changes. Thank you.
Thank you. My call on Japan, followed by Australia.
Thank you, Mr. Chair. First, Japan appreciate for reporting performance of program budget 2022 to 2023. Regarding the status of budget execution, there are differences in the execution of the budget for each center as of June 30, 2023. For example, the execution rate is 25% for Marshall Islands, while Nauru and Niue achieved 100%. We would like to ask if it is possible to execute the budget by the end of this year for all centers and how the regional office will follow up on this. With regard to the internal audit, the recommendation for the formulation, publication, and the dissemination of the WHO's country-specific cooperation strategy for Papua New Guinea has not yet been resolved. We would like to request providing a future response to this matter and the specific schedule. As COVID-19 had a significant impact on budget execution, we would like to discuss concrete solutions with the aims of executing the budget by the end of this year. Regarding the 2024 to 2025 budget, it includes the increase in AC, which allows more flexibility of the WHO's funding and more funding allocation to the country level. In this context, we expect that it leads to equitable distribution to the country level and to the resolution of the pocket of poverty. Japan would like to emphasize that a strategic approach is needed to strengthen country offices for efficient and effective program implementation. Japan will closely monitor the discussions at the AMSDG and the implementation of the WHO reforms, as we consider it to be important that WHO reforms are fully implemented as a prerequisite for increased AC. The 2024 to 2025 budget is focused on improving funding levels, and the outlook for the projected available financing seems to be promising. However, investment round is planned to take place in the second half of 2024, and the progress status should be closely monitored, as the status of the pledging and pledge conversion may have an impact on the program budget. Japan will continue to expect budget prioritization, transparency, and efficiency while addressing health issues in the Western Pacific region in consultation with the Secretariat and the member states. I thank you.
Thank you. My call on Australia, followed by Federated States of Micronesia.
Thank you, Chair. Responding to the Acting Regional Director's comments, we want to recognise WHO's continued commitment to improve workplace culture and reaffirm our strong support for positive organisational change in the region, including the gender balance that was identified, which is a really positive step. We continue to emphasise the support for staff and prioritisation of their health and wellbeing as essential to enable them to continue to perform their critical work. In regards to the program budget 22-23, we support this region's strong emphasis on allocation of funds to country offices. As has been stated, we agree this is crucial to enhance that country impact and provide additional support that member states have requested in line with their priorities. Similar to Japan's comments, we note your projected 92% disbursement by the end of the period, but we've also seen in the report still fund utilisation in some country offices appears to be lagging, with some less than 60% available in some instances. Keen to hear your thoughts on, are there particular barriers to expending those available funds? We see a reasonable level of vacancies across the program. I assume this is impacting on expenditure, so grateful update on recruitment, please. More broadly, we remain interested in the implementation of outstanding priorities in the program budget 22-23. Turning to 24-25, we also acknowledge the historic 20% increase to member states' assessed contributions. For the first time, I think this change has been reflected in the program budget as you articulated for 24-25. That aspect of sustainable financing, its role in ensuring the WHO we want to see as resourced is critical. Thank you for the process presentation. We commend the Secretariat for their efforts to reflect member states' priorities in the proposed program budget. A key priority for member states was the reallocation of resources to country offices. We note the allocation of funds for strategic priority 4.1, which was strengthen country capacity and innovation. That's decreased, I think, in our reading of the proposed program budget. Just keen to hear clarification on Secretariat on the reason for that proposed decrease, as a number of submissions and surveys have underscored the need for countries to be assisted in data collection capabilities. Thank you.
Thank you. I call on Federated States of Micronesia, followed by Cook Island.
Thank you, Chair. Just a few comments, please. I'm happy to note the obvious increase in budget allocation and utilization, which obviously filters down to the country level, leading to increasing program activity implementation. This is with respect to the 22-23 budget. The report is obviously positive. Thank you. FSM appreciates the efforts in ensuring that the organization continues to be grounded on strong and robust financial management systems. Now, with respect to increased key position and allocation of resources at country level, this is a very welcoming statement that I've heard in the last several RCMs. This is one of the most pleasing news for sure. Having WHO experts placed in country is a win-win situation for all. And I thank WHO for making this happen for many of us, as stated or implied by my good friend Minister from the Kiribati who spoke earlier. Looking forward to the 2024-2025, I look forward to developing the CCS, where allocation of the next biennium can be country-focused and specific. FSM will actively engage with you in this undertaking. Thank you.
Thank you. I call on Cook Islands, followed by Malaysia.
Kia ora tātou katoa, te ora nui o tō tātou atu o Yesu Misia. Kia ora to you, Chair, Director General, our Acting Regional Director, Honourable Ministers, officials, development partners, ladies and gentlemen, kia ora. Some of you may know, or those of you that know, my country, the Cook Islands, is very small. And so we also have very small budget entitlements. So we are thankful. We are forever thankful. And we acknowledge and thank WHO country officers in Samoa and Fiji for the unwavering support provided to the Cook Islands over the last biennium. I totally agree and support the comments made by our Director General for flexible financial support in the budgetary process and to allow country officers to make decisions based on the needs of member countries. Many times, we encounter lengthy compliance discussions for project or program support requests, and many times our country needs does not align well with WHO process timing. Should these bureaucratic processes are streamlined and empower country officers in expediting decision-making and support, I am sure we will achieve and we will implement more priority programs. So as Minister of Cook Islands, Minister of Health, I am grateful and I thank you again, WHO, and our other many development partners for your ongoing support. And I also congratulate the Secretariat and the Cook Islands supports the program budget for 2024 and 2025. I thank you, Chair. Kia ora.
Thank you. I call on Malaysia now, followed by Fiji.
In reference to document WPR RC 74/3, Malaysia takes note of the interim report on performance and utilization of the program budget 2022 to 2023. We understand that the budget has been well utilized for the region to implement the base program activities in terms of strengthening primary healthcare and supplementing member states' capacity in response to health emergencies. Malaysia is grateful for the opportunity to have worked with WHO and other partners to ensure healthy aging. We collaborated on communication campaigns to promote salt reduction strategies for non-health stakeholders and food industries. To tackle misinformation in this digital era, the WHO supported Malaysia in conducting an infodemic management workshop that further strengthens our emergency preparedness, readiness and response capacities, and our routine health programs. We also recognize the regional office has taken stronger steps in reforming its organizational structure and workplace structure, which improves accountability and performance of financial, organizational, and management systems for business continuity. With regards to Program Budget 2024 to 2025, we take note of the information document and appreciate the efforts taken by WHO in organizing the consultation sessions and regional briefings on the investment rounds and results framework for member states. We acknowledge the investment towards the 3 billion targets will be the key emphasis of the forthcoming biennium. Given the setbacks of the pandemic, we are pleased to note the program budget for 2024 to 2025 offers a higher level of funding for strategic priorities 1 and 3 that can better support capacities to strengthen primary health care towards universal health coverage and emphasize on health prevention for healthier populations. Malaysia will continue to work with WHO and other partners in the area of improving capacities for emergency preparedness and response, improve delivery of quality, essential healthcare services, and develop healthcare financing reforms for long-term sustainability that will sustain progress towards universal health coverage. Thank you.
Thank you. My call upon Fiji, followed by United States of America.
Honorable Chairperson, Acting Regional Director, and honorable members of the forum. Fiji acknowledges and thanks the Secretariat for the Budget Performance Interim Report and the Program Budget 2024-2025. We also thank WHO and other partners for the support we have received through access to vaccines, consumables, diagnostics, and treatment that have helped our nation come through the torrid COVID-19 pandemic experience. Your timely support was valuable in supporting our nation's effort, and the lessons we have learned together are critical for our next effort in tackling future global health crises. Fiji also notes the overall utilization of funds of 65.5% of the total available resources, and we encourage the WHO to continue to pursue a full utilization of the allocated budget towards the pursuit of a united vision for our region for the future towards the healthiest and safest region. One of the most delayed aftershocks of COVID-19 pandemic that we are struggling with is the exacerbation of global health worker mobility and exodus from our health systems. For smaller countries such as Fiji, this has, in many ways, severely affected our ability to deliver quality and comprehensive health care to our people. Our only feasible national response is to train more healthcare workers as we continue to lose more experienced workers from our health ministries and health services. We call on WHO and our partners to prioritize health workforce development in the next few years to help us get on top of the current crippling shortages of healthcare workers that threatens our health systems every day. We are happy to note that strengthening country capacity is one of the 3 main overarching objectives of the proposed program budget 2024-2025, and encourage WHO to consider strategic and contextualized approach to building national health capacities for member states. Fiji fully endorses the proposed program budget 2024-2025. Thank you.
Thank you. I call on United States of America, followed by Samoa.
Thank you, Mr. Chair. Our intervention will be made in two parts. So for agenda item 9.1, the United States thanks the Secretariat for the update in the budget performance for 2022, 2023. We're encouraged to see fewer emergency response requirements compared to the last biennium, reflecting the gradual recovery from COVID-19. And we note that the shift is also reflected in lower costs for medical supplies, but higher costs for travel. We also noted that the utilization rates were lower in most every outcome under most strategic priority areas compared to 2020, 2021. And we're really glad to learn from the slides about the utilization levels expected by the end of the year. This is very promising. And as additional resources are shifted from Geneva to the regions and the countries, it will be important for all to be ready and able to absorb and utilize these additional funds in a timely manner. And then for agenda item 9.2, the United States also appreciates this update on the 2024-2025 program budget and the explanation of how WIPRO's allocation will shift. And we noted the transition of the polio eradication work into the base budget and that it will be fully completed for WIPRO in this biennium, signaling a really powerful milestone for the region in facing polio. We also note with appreciation that shifts within the base budget allocation reflect the results of the regional prioritization process. We think this is really important. We recognize that WHO as a whole is receiving a large increase in assessed contributions, as has been mentioned, for 2024-2025, with much of those resources going to underfunded high priority outputs. And we'd like to understand better what is the expected total of additional flexible funds that WIPRO expects to receive from this process. And we weren't sure if we missed that in the slides tonight. And lastly, we would echo a point made by Japan and note that we absolutely welcome the advances made by WHO in reform to date. But we would also remind the Secretariat that the future AC increases will be contingent upon continued solid progress by the Secretariat in implementing reform across the organization. And we look forward to partnering with the Secretariat in this effort as we move forward. Thank you, Mr. Chair.
Thank you. Now I call on Samoa, followed by Republic of Korea.
Mr. Chairman, Excellencies, ladies and gentlemen. So I would like to commend the regional office for compiling the comprehensive interim report of 2022 to 2023 program budget. We highly acknowledge WHO technical and financial support in this biennium for Samoa through first, developing and reviewing of our health documents, such as Samoa Workforce Development Plan and Human Resources for Health Strategy, Risk Communication and Community Engagement Strategy, Tobacco Control Strategy, National Antimicrobial Resistant Action Plan, to name a few. Strengthening our public health system through e-health developments and introduction of new vaccines as part of our routine immunization schedule. Lymphatic filariasis mass drug administration, ongoing support to strengthen disease surveillance system, health security and epidemic and preparedness and responses, and much more. We take note of gaps we had identified and lessons learned from this biennium to improve our performance for the next biennium 2024-2025. We commend WHO for the 2024 to 2025 program budget being presented. We have noticed that the 5 priority areas that are prioritized in this biennium are also our national health priorities articulated in the pathway for development of Samoa for financial years 2021, 2022 to 2025, 2026. and Health Sector Plan for financial year 2019 to 2020 to 2029 and 2030. And they are also considered in the development of WHO country cooperation strategy for Samoa for the next 6 years, 2024 to 2030. Samoa is dedicated to work together with WHO and the regional office in ensuring the 2024 to 2025 program budget is implemented accordingly. Thank you very much.
Thank you. Now I call upon Republic of Korea.
Thank you, Chair. Thank you, Chair. The Republic of Korea takes this opportunity to express its support for the 2024-2025 program budget and also the three main objectives that has been espoused in the document. But we took the floor to take advantage of the presence of experts from headquarters here to ask a couple of questions. I wonder if that's okay. Our understanding with respect to the document INF/1 is that the program budget 2024-2025 was drafted with a 20% increase in assessed contributions in mind. With that information, looking at table one would expect that the figure for 2024-2025 would be 20% higher than the figure for 2020 and 2021, but it's 17%. But also, if you compare with 2022 to 2023, it's 1.6%. So I'm wondering whether the Secretariat could explain the numbers, i.e., the increase from revised approved program budget in 2022-23 to 24-25 is just 1.6%. So I'm wondering, the assessed contributions increases by 20%, but the program budget only increases by 1.6%. So I'm wondering if whether the Secretariat in its drafting of the budget assumed that with the member states paying more with assessed contributions, they will pay less in voluntary contributions. I wonder if that was part of the equation or there was some other thinking behind these numbers. So appreciate it. Maybe the Secretariat could provide the explanations. And if we look at page 4, table 2, total program budget 2024-25, we note the distribution among the different regional offices. And one could note that in the second column, for a continent, the continent is apportioned 23.8% of the entire budget, and headquarters is apportioned 31.5% of the budget. That is roughly the headquarters and this one continent takes up 50%, and the remaining 50% is distributed among the 5 remaining regional offices. And among the 5 remaining regional offices, WePro is the second from last. So I'm wondering if there is a reason, maybe the reasoning behind how this figure came about, and what we can do about increasing our portion, because I think members of this part of the region are indeed paying quite a sizable amount into the total pot. So I think we are entitled for a little more from the pot itself. Thank you very much.
Thank you very much. Are there any other representatives who wish to speak on this topic? If none, may I now call on the Secretariat to respond to the points that have been made?
With your permission, Chair, I will ask first Imre Holló to respond some of the issues raised by the delegates, and then Arpit Agarwal from our side. Imre, please.
Thank you very much, Ujana. So I would like to start answering the issues raised by China, Japan, and the US, which is basically the other side of the AC increase and the commitment from the Secretariat for Change. And I just would like to remind everybody that there are 2 blocks of commitments or reforms that have been agreed. One is under the Secretariat Implementation Plan, which consists of 96 concrete commitments that the Secretariat had set out to go about and to do. And then there are other 11 big elements under the AMSDG agenda, which is actually co-led very ably by Australia. And there are several sub-elements within that 11, and these are elements where member states together with the Secretariat have to do certain things. And I just want to say that these two packages together is a truly remarkable change if you really go through everything that basically together with you we have agreed to do. On the Secretariat implementation plan, which is in the manageable interest of the Secretariat, to date, we have implemented already 67 out of the 96 commitments. And you can follow that during the members on the member state portal of WHO, and you can see in which areas where we are with the implementation plan. So just to say that we're taking it extremely seriously, we're going ahead with the implementation, and we know extremely well that this will be looked at when it comes to the next AC increase. Then on the issue of additional flexible funding beyond the AC increase, we don't know yet. We're not aware of any additional big funding yet, but I think we will know a little bit more after the investment round if and when that can go ahead. And lastly, I just would like to also reflect on Korea's questions. So just to say that in WHO, as opposed to in every sort of other normal agencies, there's a difference between the budget and the funding. So what the figures that you have cited are the budget figures, and then we have the funding behind that we use to implement the proposed program budget. And the 20% increase is in the funding of that element. So now we will have, instead of 1 billion to implement a 6.8 billion budget, which was less than 20%, we will have 1.2 billion funds to implement the 6.8 billion budget or the 5 billion base budget. And the budget distribution of the new budget was done in a way that we wanted to increase the budget of country offices. So the regional office and the HQ segment was reduced, and basically the increased amount was distributed proportionately based on the previous budget proportions or shares of the regional offices. So that was done in a mathematical way, which means that we pro-region is not better off or worse off than it was in the previous biennium from this increase. But overall, it is in a better position because the overall budget has increased. I hope this answers the questions. Thank you.
Thank you, Imran. Then over to Arpit, please.
Thank you, Acting RD. And thank you to my member states as well for your. Thank you. Thank you, Imre, and thank you, member states, for all your constructive feedback and comments and your strong support on all the work that Secretariat has been doing in the program budget 22-23 and all the plans that we have for 24-25. So few comments that I would like to address is, number one, I think New Zealand raised this point around accountability and transparency that they would like to see Secretariat also taking forward in 24-25 and beyond. So I would like to assure that accountability and transparency in what we do in the Western Pacific Region Office is a very key agenda. Couple of things that have been done during the biennium 22-23 has been, we have a ombudsperson that was hired in 22-23. We also hired a management officer for the prevention of response, sexual exploitation, abuse, and harassment. For PRSEH in particular, we are also paying a very close attention on the mandatory trainings. As you will see in our report, I think on the couple of mandatory trainings, we had a completion rates of 97 and 99%, highlighting Secretariat's strong commitment. Wipro also participated in the formulation of the global strategy covering the 23 to 25 period. And as we speak, I think a number of action plans are now being taken in order to translate that global strategy into an action plan for the region. This includes appointing all the focal points into the countries who work with us in these areas, and a number of visits that have been taken place by the regional office management officer into the countries, trying to translate the action plan, doing the risk assessments, and building the capacity of the focal points. Likewise, in the areas of audit, you can see Secretariat's strong commitment in trying to close all the recommendations in a very timely manner. So these are just few examples, and as we continue to go forward, there are more and more areas emerging, and we are committed to work on them. I think some of the member states, including Japan, Australia, you had raised some concerns about the low utilization rates included in the 22-23 report, about some of the budget centers like federal states of Micronesia, Niue, etc. So a couple of things about that is these are the budget centers who all had resources of less than 1 million or even fewer in some cases. And what we have seen in the past is a lot of implementation happens during the last 6 months of the biennium. And from a Secretariat's point of view, we have a regional program committee that comprises of all of our technical directors in the region as well as the WRs, and we periodically engage and assess where are the areas that we need to now enhance our utilization and how we can go about implementing the plans that we have prepared in consultation with the member states. Then I think USA had raised the point that, as some of the resources are now going to be shifted from headquarters to regional office and then to countries in the form of the budget, how we are preparing. And I think the core predictable country presence that the Director General and the acting regional director response or their reports contained talked about 54 odd positions comprising of $18.7 million. I think this was probably also one of your questions, how much support we will have in the region. I think these are the core technical positions that will go into all of our countries, and that will also translate into how we can take forward these plans that we have formulated for 24-25 for the implementation. And then I think there was also a comment about the PNG's country cooperation strategy, for which there was an internal audit finding and what the Secretariat had done. And after the recommendation was issued, there was a very strong engagement with the country office, including the Ministry of Health, other donors and partners that had gone into the evaluation of the previous CCS, what were the findings, and that had been taken into account as we were preparing the new country cooperation strategy. And I think the acting regional director comment mentioned that by the margins of the RCM, we are also anticipating the new country cooperation strategy to be signed. So with that, perhaps I can hand it over back to you, Acting RD.
Thank you very much, Imre and Arpit. So we appreciate very much the valuable comments and guidance of member states. And we would like to assure you that we continue to actively monitor the implementation of activities and will ensure to enhance our business processes, which are all focused on achieving impact at the country level. And the Secretariat strives for the most efficient use of all resources. As Arpit pointed out, we have the program committee, which meets every week these days, so that we regularly, every week, systematically monitor, together with the budget centers, the implementation. And we are truly confident that the 65% that you have in the June report will go up to 92%. And then also the signature with the PNG CCS, that will be Thursday morning at 8 o'clock this week. So we are following up on all these issues. And let me thank you all for the valuable input and comments and guidance. And we will follow up on all issues that you highlighted. Thank you. And with this, back to you, Chair.
Thank you. So we have now reached the end of today's session. We will reconvene tomorrow at 8:30 in the morning. Immediately after my address, we will proceed with the private meeting. This evening, there will be working dinner for the regional committee members, heads of delegation +1, to update on member state-led processes to strengthen pandemic prevention, preparedness, and response. I would now like to invite the Acting Director of Administration and Finance, Mr. Arpit Agarwal, to remind us of the details.
Thank you, Chair. So, couple of updates. One is, after the plenary session, a first meeting of rapporteurs will be held to discuss the work of the group for the week. In terms of transportation, transport to the Manila Hotel and Sheraton Hotel will be available at the end of the session, which is now. Transport to the Sheraton Hotel for 2 days working dinner for those who will be attending and are staying in Manila Hotel will be at 6 p.m. The session tomorrow at 8:30 a.m. will start with the address of the incoming chair in the conference hall, followed by nomination of the regional director in a private meeting. So if I could just remind the colleagues that private meeting implies that participation is limited to representatives of members and of the committees and areas, their alternates and advisors, and essential secretariat staff. Other participants tomorrow may go to overflow room or back to respective hotels. Shuttles will be available from 9 a.m. onwards after the chair's remark to take them back to the hotels. And transportation from Manila Hotel and Sheraton Hotel back to the regional office will be organized tomorrow from 2:30 p.m. onwards. Those who will not be in the conference hall tomorrow shall wait for nomination announcement in cafeteria or the overflow room 210 that we have. And afternoon coffee break will be organized in the cafeteria. So with that, I hand it over back to you, Chairperson.
Thank you, Arpit. So thank you very much, everyone. We'll see you tomorrow. Thank you. Or tonight.
We wanted to do that really quickly right here. Yeah, so I'm gonna go get the rapporteur.
That was fantastic. My gosh. Good. Oh my God. Oh, fantastic.